Okay, we're gonna get started. It is.
Make sure the mic is on and then talk.
Can everybody hear me? Diamond, can you hear me?
Hey, Dominique, you're good.
Okay, thank you, Sonia.
So,
Yeah, it's just really low.
It is.
they are low. I don't know if this, yeah, I don't know why.
I wonder.
It's so low.
I wonder if this is. Okay, Diamond said yes. Okay. All right, so the time is 7:13, and we're gonna get this Public Health and Education Committee meeting started. So, welcome everybody. This is our last meeting for the year, and I'm really sad. I know it won't be that long, but it will be a little bit, right? Before we know it. So, do we have any elected officials on before I start the presentations? Okay, so I'm gonna start off with Diamond Adula, who's going to, actually, sorry. We're gonna start off with the community health focus first. Do you wanna go first? Okay, we're gonna start off with the community health focus first, and then after that, Diamond, you'll go next, okay? All right. Let me exit out of this. I don't, everybody who's here, that's everybody.
That's everybody.
Yeah, that's everybody. I don't know why I don't want this on full screen. There we go. All right. You said your flash drive is in, right?
Dr. Joseph, it's such a pleasure to see you.
Okay.
Yeah, it's my pleasure to be here.
What did you say?
I can't,
I'm sorry, sir, what did you say?
I said it is my pleasure to be here after some time.
This one? This one?
Yes.
Okay. Hold on, I'm gonna do a full screen and then where are we?
And Joan is not here this evening, so I'm reading her
Okay.
response.
Sorry, I'm just looking to see how to full screen this. It is really small. Hold on.
Did we do reading?
Yes, we did everything. I'm just starting with the first thing. That's what I was just looking for, but I don't see that. But okay.
What's fine?
There we go. Okay. There you go. We're not talking sorry.
All right, good evening, everybody. So the health portion of the committee, we decided to talk about men's mental health. June is Mental Health Month for men. And we're going to be looking at the keys to well-being. So we're talking about when it is not weak to speak. So we're encouraging men to speak about any mental health illnesses that they might have. I'm going to the next slide. The concept of well-being, since June is the month, we want men to be more open regarding the silent epidemic that is really plaguing our country. Working in an emergency department, I'm seeing a lot of men, especially men of color, come in with attempts of suicide and being referred for psychiatry. And this is due basically to not being able to provide for their families, due to the economy of not being able to find jobs, due to the plague that we have of drug use in our community, and also with lack of education. So we're encouraging men to really try to speak about their mental health because it does impact our families and impacts people that we work with, just community members and friends in general. So the rates of male depression and suicide have been on a rise. We've seen in recent years with mental health issues, men die more of suicide than women. We find men use more of violent ways to commit suicide, unfortunately, and they are succeeding. They estimate about 6 million men in the US have experienced some forms of psychiatric depression, every year. And despite this, men still feel depressed, even though they have admitted it to like family members in their lives. They are still suffering with depression. So the perceptions of weakness and fear of therapy and fear of social disapproval is what is a hinder for men seeking any type of help. So the reluctance for men to seek treatment is because it's not diagnosed, it's because failure to recognize symptoms. So we look at symptoms like just not going out, not getting a job, not going out with their friends as maybe being introverts when actually they are depressed. We also, and men, sometimes downplay the signs and symptoms, and they're reluctant to express depression symptoms, which we're going to talk about. And this, in actuality, resisting mental health treatment. The mental health treatment, right now, there is a shortage of mental health providers that are geared towards people of color in general. In September, I plan to go back for my psychiatric mental health nurse practitioner degree to help men of color and men and women who are veterans, to help them overcome stigmas that they are encountering and not seeking help, because there's not enough people that look like us helping them. Mhm. So the warning signs of depression is basically talking negative or expressing any type of hopelessness. We see them acting out without any concern for others. And the use of drugs and alcohol, especially in our community, is on the rise. So we see men who use a lot of alcohol. We just say, oh, they're alcoholics. No, there's underlying issues that are there. And withdrawing from friends and family. So when you go to visit a family member and this person is always in the room locked up, that is a form of some sign of depression that they might be experiencing. And also, if they're married, suddenly talking about divorce or separation from their families, complaining about pains that are really not there, but what we call psychosomatic, that pains that they don't really have, but are related to mental health, eating too much or not eating enough, and sleeping is like the number one sign of depression that people suffer with. So ways we can look to help, have that open conversation, initiate that conversation about men and mental health to help reduce that stigma, because we want to help to promote access to healthcare and support services. And there are resources, there are mental health services, there's crisis hotlines, which we have a list at the end, and access support and care when needed. And we also have to create that safe space for our men, especially our men of color, encouraging them to with support with home, work, school. We can do it in barbershops. We can do it at the gyms. We can do it in churches, in the community. If you just see somebody that you see on the corner all the time and they're not doing anything, just saying hello, or maybe if they need any type of help. Because we have to try to lift that fear of judgment and stigma to try to help promote emotional wellness for our men. And here's a list of resources that are available, you know, the 9AA suicide hotline, the veterans hotline, substance abuse hotline that are available for men and anybody that you might feel that might be. Okay. And oh, I didn't turn that slide. I'm so sorry. But thank you very much. So that's our presentation on men's mental health.
Just to add one thing as a mental health professional myself, we don't talk enough in our community about depression that looks like irritability, annoyance, or even talking about coming home doing the same thing every day. So we have to start talking about depression, but not in like what I call the DSM land, because depression in Black people does not look like it does in that book. It's just a scaffold. It is just a frame. It is not the answer. So I feel like we need these forums to really start talking about what depression looks like. It's not always sleep. It's not always eating. Sometimes it's a whole lot of other things that we think are cultural, but it's really depression. So I think the conversation also has to start there with talking about what depression really looks like amongst us as people of color. One of the classes that I teach, assessment and diagnosis, I'm always telling students, stop looking in that book. It's not culturally responsive. It has nothing to do. It does not connect us with anything. So what we really need to start with is just asking people, hey, are you okay? And if you're not okay, it's okay not to be okay. So normalizing the small things is really where we need to start to build that community so people can open up. That's just my 2 tidbits. Yeah. Yeah. I feel like we don't model enough about saying that we are not okay and like showing that we're not okay. I have become comfortable with asking for help, even though that was a very hard thing. And I've become okay with saying, hey, I'm just not okay today. Like today is just not my day. And you know what? As humans, we all entitled to have some days. So I say that to say we have to start having more of these conversations so that people create that community and feel more comfortable.
What we were talking about in church, because my church has what they call the man cave. And basically to say that it's okay to ask for help, you know, like even women and men, but just as a culture, okay, we always feel like we have to be strong for everybody. Somebody dies, even in grief, the first thing you say is, be strong, my sister, be strong. And you have to say, no, when my sister passed, I was like, no, I cannot be strong today. Maybe not tomorrow, maybe not for a long time, you know, but I'm not going to be okay. And it's okay to cry. It's okay to break down. I know men feel like they're weak if they cry. It's okay to cry. You know, it's not a sign of weakness, you know, and to start talking about your feelings and just say, I always tell people, give yourself a few minutes, but minutes now have turned into days. Have your pity party. It's okay to have your pity party and then get back on your feet. You know, we fall down, but we stand up, but sometimes you have to be down for a little bit, you know?
Also, we have to encourage coping skills. I feel like as a community, we don't give enough coping skills. And I feel like one of the things I would love to do on the board is like getting like either a walking group or like journaling or just having conversations around this. Because sometimes people really don't have the space to talk. They don't know who to go to because sometimes they don't have anybody to go to and their trust is not there. So I feel like these are things that we can think about in the next coming year. Journaling is like one of my things. I journal every day. Is it always good? No, but I've been journaling better, but I've been journaling more good things. So you're so silly. No, it's true. I say that to say we just have to build things for people and they will find what they need to find. All right. Anybody else got any other comments before I move on? Okay. Diamond, the doula.
You know, the comment.
Hold on 1 second, Diamond. Hold on.
I was just thinking of what you said, when you said over there.
You gotta use the mic, Johnny.
When I was a kindergarten teacher for public school or elementary, I always had the upper grades because I guess people thought I was tall and I was able to handle the big ones. But when I opened up my first nursery school, I came down to kindergarten I had always 25 children and you didn't have paraprofessional at the time. Parents would come and volunteer, but not really. But what I found to know and get to know my students were coloring and vision board. I would always bring in their ads from the supermarkets, you know, their paperwork when you have sales. And I would always tell children, if you have a magazine at home, at that time, parents had magazines, lots of it, you know, and they would create this vision board. At that time, I didn't call it vision board. I just call it me, yourself, and you creating yourself and coloring. And I noticed how I learned my students based on the kind of crayon they used. Most children would like multicolors to make the picture look pretty. Then you find a lot of students that weren't as outgoing or more or less to themselves would wear darker colors in terms of crayons. And I learned that from, like you said, pity me and move on. You can't do that sometimes. You have to take it easy. Everybody's different individually when they lose someone close to them. Thank you.
Awesome, awesome. Okay, so we're gonna have our presentation from Diamond the doula now. Go ahead, Diamond.
Hi, good evening, everyone. Thank you so much for having me on today's meeting. My name is Diamond Azula. I'm here sharing about the Bronx Preeclampsia Prevention Campaign. To start, I just want to say I'm a doula in the Northeast Bronx, in the Wakefield community, supporting families and with physical and emotional support in pregnancy, labor and delivery, and postpartum care. And you all were just hitting on such great points about mental health for everyone. And so when I highlight a few things, I just want to, touch on some of those points as well about preeclampsia. This initiative that I'll be sharing on today, and excuse me, I'm just looking down at my notes here, is in conjunction with Bronx Healthy Star Partnership, as well as March of Dimes. And so the Bronx Preeclampsia Prevention Campaign is a borough-wide hospital-anchored initiative delivering community education, early screening tools, and direct engagement to reduce preeclampsia and improve maternal health outcomes across the Bronx. If you're familiar with preeclampsia, it is a persistent, increased, or high blood pressure that develops during pregnancy or postpartum period. And so we know in postpartum, it is difficult enough um, in, pregnancy, labor, and delivery. And oftentimes we think of mom, we think of that family unit, we think of baby, checking in with them during pregnancy. But often they're forgotten after baby comes along. We feel like they have it within their household, that structure is set up, and oftentimes it isn't, and so we'll see preeclampsia persist when mom is dealing with lots of things going on, which can be associated with increased levels of protein in the urine, seizures, visual disturbances, abdominal pain, breathing, vomiting, shortness of breath, and other symptoms. And we don't know a lot of times that this is going on with moms because we feel like they have it. And often mothers, they feel like they have it, right? They go through these symptoms, maybe unaware, and we can check in with them, buying them a blood pressure cuff, asking them, hey, how are you doing? Have you eaten? Have you checked in with your healthcare provider when you have these things going on? And so in the Bronx disproportionately faces high rates of preeclampsia and maternal health complications, driven, of course, by structural inequities and limited access to early screening. And so with this preeclampsia prevention campaign, is delivering a plug and play model, hospital anchored hub model, actually connecting hospitals, community-based organizations, and trusted partners to screen, educate, and support Bronx families throughout their time. So this can be again in them thinking of preconception planning during pregnancy, labor and delivery, and postpartum, because it's important to check in with them throughout that time, right? We like to use the phrase postpartum is forever because it doesn't stop just because 6 months has gone by and they have that official check-in, right? That capacity goes well beyond that time. And so the purpose of this is implementation of the Bronx Preeclampsia Prevention Campaign, low dose, big benefits. Is to coordinate with community partners, as I said, host educational events, and expand awareness of preeclampsia prevention across the neighborhoods in the Bronx. Some of the bus ads, the ones that are at the bus stops, locally in English and Spanish, just highlighting this campaign. And some of the goals are to increase community awareness of preeclampsia symptoms and prevention, promoting early prenatal care and prevention strategies such as the low dose aspirin when recommended, because that started in pregnancy, just 81 milligrams daily, can prevent these issues throughout pregnancy and again later into postpartum, where we see these symptoms increase. And overall, encouraging pregnant residents to speak with their healthcare provider about risk behaviors. And lastly, to build a coordinated network of community partners across Bronx neighborhoods. So some of these partners would be elected officials, district leaders coming to you all like in the community board, faith institutions, NYCHA developments, community support programs, WIC offices, prenatal support, healthcare providers, and retail establishments, schools and colleges. So within this hub structure, we're located being in the North Bronx and the North Bronx hub, as well as the West Bronx, East Bronx, Central, and South Bronx hub. And again, this is important as the Bronx has the highest pregnancy associated mortality rate in New York City. Well, let's just say, if we're familiar with the Not 62 campaign about our overall health outcomes as being the county with the worst health outcomes in New York State. And so we just ask you all to join us in this call to action to prevent preeclampsia outcomes for Bronx families. So please continue to share this information. I do have flyers and other pieces of physical materials that can be disseminated as well as the digital campaign. You can feel free to follow Bronx Healthy Start as well as March of Dimes and myself and our other partners that are sharing about this vital information as this 90-day campaign continues as it started in May through June and July and sharing this information beyond. Thank you so much.
Thank you, Diamond. Diamond and I had the pleasure of meeting at one of the meetings that basically started this campaign, and we've been trying to work collaboratively together to kind of get a lot of awareness out about the preeclampsia campaign because it is a really, really big deal, especially here in the Northeast Bronx. We have one of the highest rates. It is a very high rate. I can't remember the statistic right now because I'm not in the social work mode, but it's a very high number. I say that to say we really have to spread the information about this so that people know. So it goes from moderate to high risk, correct, Diamond?
Yes.
Yes. So it goes from moderate to high risk. And telling pregnant people, I say people because I'm inclusive of all people, to take aspirin. So we really should be getting out this campaign. Diamond and I both have information and have flyers because we are both a part of the campaign as well. So thank you very much. Did you want to say something, Karen?
Basically, I'm having a question because I've been out of the work environment for about 5 years now, retired in high-risk OB. Are they offering or is the insurance companies paying for home visits postpartum to check on blood pressures, not basically just to do an exam, but, a little bit more than just an exam? I think that could be, a visiting nurse, regardless of how long you were in the hospital. Since I think is an insurance company paying for doula care?
Depending on which insurance.
If they're Medicaid, will not pay for it? Yeah, because I think of just a standard of care because of our mortality rate, maternity mortality rate, if you can get follow-up exams, visiting nurse to come into all the postpartum homes after delivery would be a big, big help. And for them to know symptoms.
Yeah. I would say if Dr. D in a perfect world could have her way and wave her little magical wand, if you were a pregnant person, I would have one-stop shop drop. You'd have a doula, a midwife, a OB, you'd have the social worker, you'd have basically come to one place and you'll get all of the services and then they follow you for the next 2 years. And at the end of the 2 years, if you still need services, then we continue to service you.
It's really a shame because it's only in America.
This is true. This is true. It's only in America. Yeah, they don't. Yeah.
woman gets served up to
1 year, yep,
1 year follow.
yeah. Which is really interesting, just like only in America they give birth the way that they do. Everywhere else, they don't give birth the same way. So that's also an interesting concept. But any other questions for Diamond? Okay. Do you want me to let him go? Oh, okay. I wanted to make sure. Okay. Moving along. Troy, I think you are next. Okay. All right. Okay.
Okay, good evening, everyone, and thank you for tuning in. I just want to say first, Happy Pride Month. I know. As we mark Pride Month, I want to take a moment to recognize what Pride truly stands for. It's not only a means for a celebration, but also awareness, dignity, and a commitment to the safety for LGBTQ plus people, especially our transgender neighbors who have faced discrimination, harassment, and exclusion for far too long. Pride also honors the legacy of people who fought for change. One of those people being one of our most enduring figures, Marsha P. Johnson. Marsha was a Black transgender woman and an important leader in the struggle for LGBTQ liberation. She is widely recognized for her role in the Stonewall Uprising in 1969, an event that became a turning point in modern LGBTQ plus rights. Her life and activism helped shift public attention from invisibility and criminalization toward resistance, visibility, and community power. And I believe it's important to remember that fight for LGBTQ plus rights and has long been tied to fighting for justice and accountability, especially around policing. The early organization for LGBTQ plus liberation wasn't just about winning recognition. It also began as part of an anti-police brutality demonstration rooted in the reality that LGBTQ plus communities, like many others, have been targeted by abusive enforcement and harassment. That history reminds us that civil rights and community safety have always been connected. Her legacy also reminds us that transgender people are not a modern debate. They are also a part of our history and a part of our community. In the Bronx, transgender neighbors contribute in countless ways through culture, service, mutual aid, mentorship, activism, and everyday acts of strength and survival. Transgender people have deserve more than acknowledgement. They also deserve our respect, protection, and equal access to resources that everyone needs to thrive. So this Pride Month and beyond, I'm asking us to recommit to a simple but few essential principles that transgender people are treated with dignity in our schools, workplaces, shelters, and public spaces, and that discrimination and harassment are not tolerated, and that our community supports inclusive policies and services that reflect real needs, particularly for transgender people of color and those facing housing or economic security. So I ask that let us honor Marsha P. Johnson by continuing the work she helped ignite, building a Bronx where everyone can live openly, safely, and with full belonging. Thank you.
Thank you, Troy, for that awesome presentation. Look at that. You did that. Look at that. Look at that. All right. Next we are going to have Miriam speak with Mama Voice. You got this. All right. Yeah. I'm gonna get.
There's a mic right there.
Oh, and there's a mic right there. Miriam, there's a mic right there. I forgot that too.
Hi, everyone. I don't know how to do this, but I'm developing a maternal app for Black and Brown women where they can find essentially, non-racist maternal care provider, because I don't think I need to educate anybody in this room about the struggle that Black and Brown women faces, especially Black women. And And I don't know whether you know or not, currently in New York City, like Black mothers are 12 times more likely to die from preventable like complications. And, 46% of those, 46% of the reason that is simply because of discrimination, not because, those women, not because those women are, less educated or are poor. So, and that's why I decided to develop the app. And I don't know how to, like, I have the prototype and I would love to show you, but I don't know how to do that. So, um, uh, it's not a website yet because I haven't launched it yet. Currently it's just a prototype. Yeah. Yeah, I do. No way.
It's not shareable yet, but it's not. Yeah, I was screen. I mean, yeah. Hold on one second. We're gonna show this prototype. You could go on the website, right, Miriam? Say that again? Page 44. Page base 44. Okay, sorry. Like that?
Yes. I'm gonna ask you.
Okay. Yeah. So good. I want you to be able to show the great work that you're doing.
Oh my God, I guess. I'm sorry. I can't think of it. But that's perfect. That's perfect. I sleep.
Okay, I'm gonna share the screen so we can show. Oh, sorry.
And hold on, I can actually make it better. How can I get rid of this? Oh. Okay. So that's better. So this is where you can find providers. Oh, I'm sorry. Oh, okay. Okay. So this is where you'll be able to find providers, and you can click on view profile. I mean, it's currently empty now because it's a prototype. So you'll be able to read about them, see their picture, what they look like, read about their cultural competency. You'll be able to see their reviews here, reviews about the doctors here, their availability, their contact info, the insurance that they take, and the kind of language that they speak. Because I understand, Black women comes in all forms and languages. So yeah, and here you'll be able to see their credentials. And the best thing about Mama Voices, the care providers here will be recommended by Black women, and or like Mama Voice will also like verify to to be double sure that the care providers are truly culturally competent. So you rest assured that any providers you get here, they're not gonna kill you, because that's the main point. Yeah. And if you want to, as a Black woman, if you want to recommend a provider, this is how you do it. So you choose your race, you choose your gender, because for the recommendation, is only Black women that can recommend, and I don't need to explain why that is. I think it's obvious to everybody in this room. So, and you'll be able to put the name of the doctor. Let's say it's Dr. Johnson. And we continue, and you can, choose like click on the ratings for the doctor that you're trying to recommend. And I decided to put all this because I wanted to hear what defines, Black and brown women definition of cultural competency about the doctor that they're trying to recommend to another Black woman. And it would be, is it the fact that they feel welcomed? Is it the fact that they feel seen? And if all these choices do not speak to you, in regards to the doctor that you're trying to recommend, you can click on order, continue, and here you can tell your story, because we want to hear it. That's the basis behind this app. We like, we're not trying to like suppress Black women's voices or Black mothers' voices. We want to hear it. Tell us how we can help you, because this is why the app is created. And also, we're not just doing access to our culturally competent care providers. We also have resources, because we realize maternal self-advocacy is important, especially for Black and brown women. So we're also going to have resources and guides for maternal advocacy, and we're also including partners, because we realize most of the times, partners are left out, which it kind of makes sense. They're not the one carrying the baby. But with that being said, sometimes partners also need support so that they can better support, whoever is carrying the baby. And so we also have a community space. This is where our moms can connect with other moms, and for community and peer group support. And that's about it. And we have the feedback, because again, we wanna. This is the hub that's created for Black women. We want to know what's working and what's not working with Mama Hub. We want to know how to help you, how the platform can better serve Black and brown women. So, yeah. And this, by the way, is actual feedback from you people. So, yeah. And I think that's about it. Yeah. Thank you. Okay. Sure.
First, I just want to say that's a brilliant idea. I mean, really brilliant. Do you extend beyond New York State?
Oh, yeah. Currently, since, the everywhere you go, Black women experience discrimination.
Yeah.
Whether you're in New York City or you're in DC, it's the same discrimination. So yeah.
Yeah.
So I understand, whatever struggle that New York City Black mother is going through to give birth, another Black woman is going through the same thing in North Carolina. It might even be bad over there.
And in Carolina, because that's where my niece is from.
I'm
She
sorry,
went
I
through-
don't mean
No, she
to-
went through discrimination down there while giving with her first birth. And for the second one, she was like, I just have to go with the same person. And I'm like, you shouldn't have to go through that. Even
Yeah.
just to get a doula
Yeah.
is difficult for her,
Yeah.
you know.
And that's also like one of the reasons that I'm creating this. I want to give Black and brown women a choice. Like, you know, if you don't have to go through racism to give birth, you know. And if Black women don't have this kind of resources, they might be forced to, because, you know, once you're pregnant, you have to give birth to the baby. So I want to give them that choice, and, you know, and saving their life as well. So yeah.
Yes, very good idea. Very good.
How are you finding the providers?
Okay, so the providers will be, like I said, it will be recommended by Black women only, and then Mama Voices. So part of the people that I'm gonna be bringing on the team is gonna be a licensed maternal care provider that can actually verify. That will help Mama Voice verify that the providers are actually and truly culturally competent before they get on there. So you can get on the app, even as a Black person, even as a Black provider, because don't get me wrong, I love Black people, but I've met some Black people that they think they're white, and you're like, no, you're not. So even as a Black person, you're not getting on unless and until a Black woman recommend you to be, you know, like, you know, racially sensitive and culturally safe. And we verify that on our end, that, you know, what she said about you is truly true. So then you come on the app. So yeah. Thank you. And so just to add one more thing, so I'm looking for a software. So if anyone knows, I'm looking for a software developer to actually transform the prototype into a secure and scalable platform. So if you are a software developer, or you know any software developer who is Black, yeah, I want Black people. They could be female, they could be male, but I want Black people. You know, I want to keep the money in the community. Yeah, so. Thank you.
If I could add about Miriam, Miriam and I met because of a collab that I had with Uptown Boogie that does a farmer's market. Sorry, I couldn't remember the name. I was given her information by them, and they know that I'm a Black maternal mental health expert, so I'm calling myself an expert these days. So they knew that I was an expert, and they put me in contact with Miriam, and it was probably one of the best things that they ever did, because from day one, I told her this was one of the most amazing things I had ever seen. And I told her that this is definitely well needed, and that this is really important for our community. Miriam also didn't say that she doesn't do anything in this field and created that app. And that to me is even more powerful. She saw that there was a crisis and she did something about it. So for me, I really appreciate that about Miriam. Miriam has a totally different career, if I'm not mistaken, and decided to no. And that's what makes this that more powerful for me, because she saw a crisis and wanted to do something about it. So I really, really, really believe in Mama Voice for that. What happened? Oh yeah. Listen, when I first saw this, I was like, whoa, you did all of this? Like, whoa, this is kind of cool, you know? So I'm really excited to see when this comes to full fruition, what this will be like, because I will definitely be a person that's promoting the app. So you don't even have to ask. I'll, be on my Instagram or whatever promoting. So yeah, it's just a really great thing. With that, Eat, do you want me, go ahead, hold on. Go ahead.
I have a question.
I'm sorry, Dr. Joseph, what did you
I
say?
have a question pertaining to the last talk, the app. I have a concern though. It's really a concern. The fact that we live in a multicultural society and having something that is just geared to a particular population, isn't there the risk of a lawsuit that some folks cannot
No.
use it?
No.
I mean, it's a great idea. It's a problem, it's a solution, but there's a but. It can be deemed that the solution is a bit restrictive. So how about you? I
E-
understand what you're trying to do.
Okay.
And
Before,
in terms of development, maybe you could go around university and get some college student to do it. But to say that person has to be black, that could be restrictive because it's not too many black folks just studying computer science and engineering. So you while you're solving the problem, it appears to me that you're also restricting the solution. So maybe you should talk to a lawyer as to whether or not you could do it the way you want to do it.
hold on. So what is your question, if you mind me asking?
It's not a question, it's a concern.
Okay, so your concern is that she wants primarily Black people on her team. Is that what your concern is?
Yeah, in a multicultural society. Yeah.
Because, so Dr. Joseph, we could
Yes.
disagree to agree because I work at a private practice and we're all Black women. Even in
Okay.
a multicultural society, in my practice, there are no people that are not Black, and we only service people that are Black. That's the reason why we created the practice.
Okay.
And
What if someone else who is not black come along? Are you going to deny them?
what do you mean? But what's Black and brown women are dying. I don't know if you know 1 out of 3 Black women
Oh,
die
I'm
during
very much
childbirth
aware
every
of the
day.
problem. I am very much aware of the problem. So it's not one of awareness, but I'm also aware of the fact that there's not too many of us in STEM area, mathematics, the engineering, the technology, and so on. I'm aware of that too. I'm aware of the fact that there's not too many of us in what you were talking about earlier about healthcare and so on at the level that we can really effect change. So I'm aware of that too.
Okay.
And I am cautioning being too restrictive.
But if you develop an app, you can give people a choice. So she said it's Black and brown women. Black and brown women is a very broad category. That could be from here to a very broad spectrum. She didn't say the African diaspora. She didn't say the West Indian diaspora. She said Black and brown women. So however anybody identifies, they identify. It's her choice. Just like it's my choice at my practice that we only help Black women, that is our choice.
Be
So
careful.
if you want to run your app, if she wants to run her app like that, that is what she wants to do because that is her right and that is what she believes in.
You
These are
don't have
for
much
women.
in a society. You don't have much of a right. You have to respect the right of others too. So it's not. It's you say you're in a democracy, then you're not a. You don't have
But
all that
these are
rights
for
to
women.
do. It's just my caution. It can be ignored, but it's my caution.
I, I understand what you're saying, but white women have choices all over the world. Okay, this app is for Black women that are requesting Black providers because they want someone that represents themselves. They have a choice. As a woman, I have a choice if I want to have a different type of provider, but I'm looking for somebody that's going to represent me and understands my plight of what I'm going to because I have been ignored for years and decades and centuries. So it's a choice.
Also, we have to look at the healthcare disparities within our community. There's not a lot of representation especially with mental health regarding maternal health, that there are people who are providing and it's very few and far between. So if a person wants to have a Black or brown provider taking care of them, there should be no problem with that or no issue with them being provided with one and looking for one. White people have always had the privilege of having providers that look like them, that can provide for them in their communities. This has been proven over time with the lack of being admitted into colleges, being provided with schooling. And now that Black and brown people are more, I could say, like, not on the rise, but are more prevalent in our communities, there should be something that makes it more easier for us to be able to find them. And this is what the app is about.
I
You
know
need to make an
exactly
app
what
for
the app is
psychiatric
about.
mental health also.
I was listening
That's the next.
and I gave my caution.
You have a concern.
I'm sorry, can you speak up? Can you say that one more time?
I gave my caution, and so that's as much as I will say. In terms of developing the app, then, you know, you can go to any of these technical high school, college, maybe high school student, but college is better. Get an undergraduate person in a technical field, computer science preferably, and they should be able to do it. But again, I caution the restrictiveness of it.
Thank you. Etonia, and then Daryl, and then I'm gonna move on. Oh, sorry, and then Sheila.
Well, hi, Public Health and Education Committee. How y'all doing?
Hi.
Pretty
Hey.
good. All right, so I'm switching hats real quick, but I'm not ever switching up on y'all. And to back everything that y'all mentioned earlier, yes. What Dr. Joseph is saying is correct in the regards of us being underrepresented. By us, I mean people of color underrepresented in tech. However, I dropped in the chat some organizations that are helping to bridge that gap, as well as I totally agree with the presenter beforehand and everyone on the board of that the program that the presenter is talking about is to assist marginalized communities. So is in no shape or form exiling anyone else that identifies outside of those parameters. They are more than welcome to attend and get the services provided. It's just that the emphasis is that the program is primarily for these marginalized communities because they were left out of the demographics greatly served, as everyone said beforehand. So that was just my 2 cents with that. So we can just wrap that up. Now we go into voting because we're also going back to our other due diligence that we have to do. So again, switching hats. I am not your chair. I'm your first vice chair for CB12, but I am the chair of environmental climate justice as well as veteran affairs, and I'm the leader of civic engagement for the Williamsbridge branch of the NAACP. The NAACP does not need any introductions, but I'm going to do it anyway. They were cultivated in 1909, is 112 years old, it is the leader of social justice within our country. So the main thing that we can do to actually make sure that we even have a country is do our due diligence in voting. And most people don't even know there's a primary going on right now because some people don't think that local elections are important. Everybody that's in there is in the community board because somebody from a local election appointed you to that position. So with that said, we already know how important elections are because we are the same voting body that literally decides the best decisions for our community based off of their input. So this is going to be real quick and real painless. If I could share my screen fairly quickly. And there we go. So can everybody see the Find My Pulse
Wait,
site?
Etonia, hold on. Etonia, hold on 1 second. Hold on.
Right, no problem.
Hold on. Daryl wanted to say something and Sheila wanted to say something. So just, and then Tolene wanted to say something. Can you give us about less than 10 minutes and then you can go back to your screen share?
Absolutely.
Okay?
All right.
All right. Thank you. Go ahead, Daryl.
So I guess my first question is, I really love the app idea, and the app is such a great idea for, especially for like our more marginalized populations, and especially specifically for Black women that go through this. But I guess my question is, can anyone utilize the app to recommend a doctor or someone that may be, you know, someone that Black women can utilize? Like if I have a friend, you know, that I go to school with, and she's like, you know what, I know a girl that's an NP or OB or whatever the case may be, and I'm going to recommend her. Would she be allowed to do that? Yeah. So I think that's what he, and I don't want to interrupt you. I think that's where he may be coming from, but I think maybe it would, and I don't want to put words in his mouth, but I heard it differently too. But when I started thinking about it, like think about when we have like African American or Black dating apps, right? You can go on that dating app, it's catered towards that population, but other people are able to download it and access it. You know what I mean? So I think that's the point that he may be trying to make or imagine. And that's the part to more so look into if you can restrict it in that matter, if that's what you were looking to do.
Don't get me wrong,
Yeah.
anybody who use the app, you know.
Okay. So,
Yeah. But when it comes to those who can bring or bad,
okay.
exactly. And like you and I, you know, why, because if I, if like, like a step provider and white women recommend, my race is to a black person. And if I allow white women to recommend and provide, who's actually racist? And, black men goes there and teach him that, then my heart was saying, my heart was huge. And so I'm saying, because the app was founded to save that different. And if I let anybody raise, like recommended provider, then black women might not be benefit and way that comparatively for black women who now go down.
Yeah, I totally understand what your concerns are too. I think the thing is now to look into if that can actually be done, if you can restrict it in that manner. Yeah.
For the setup, I would be, you know, it would be a lawyer involved.
Yeah, because how would someone know if I'm a Black man or a Black woman if I'm logging on the app? Am I gonna have to like, you know, identify myself, you know, upload my driver's license? Like, you know, so that's when it gets into like, okay, this is something that you may need to see if you can actually do, yeah.
Well, like, once we don't get, that's something we're very much in a question. With how to go to like a, black woman, like, older, like,
And you may have some allies too, because what if I went to med school with someone and I'm like, and I could be Caucasian, I'm like, my homegirl, you know, Ijoma, she's nice. She could do this. Like, you know what I mean? I should be able to recommend her. That's just what I'm saying. That's just from my perspective, yeah.
Sorry, hey y'all, they can't hear you on this end. You gotta use the mic.
She said she want to say something, but we got to move this on because if we stay here all night, we're going to be on this all night. So Sheila and then Tolene, you're going to say what you say. I'm sorry, Carol, but I'm going to let you talk during your presentation, okay? Go ahead, Sheila.
So my understanding is that, you know, there's a lot of websites, like one day I was looking for a dentist and I went on ZocDoc or something. And I'm able to click on who I want to get. So if I want to get a woman, if I want to get a black woman, if I want to get a white man, whoever takes my insurance, I should be able to, when I pick who I want, it'll take me to her website because I'm going to pick a black woman that's not going to let me go through pain because we know what that whole thing is about. They think we can take more pain than anybody else. So it should just direct me to a black website but that's my choice. So I'm going through ZocDoc, which is probably a white site, but whoever I pick and I choose on that should take me to a site of the person that I'm looking for. So, which brings us to her site. And black and brown women are not just, we come in all kind of colors. We're all mixed with everything. So you might get a dark-skinned Hispanic woman, but if she identifies as black and brown, she should have a choice also, because now she's not only subjected to a white person. Now she's probably saying also, because you know everybody's mixed. Everybody has a drop of everything in them. So, you know, we should be able to pick who we want to go to and not be subjected just to go to who you want me to go to. We all have a choice on who we want to go to. So, also, sorry, one more thing. I did see online one time, I believe it was maybe a month or two ago, there was a white man who was suing a black company for reparations because, right? Because he's saying that no black person he felt it was reverse discrimination. Because now we have our own thing and he's not entitled to be on it. What a crock. Right.
And that's the problem, right? Because, like, you know, well, one thing
Yeah, yes, got this.
right? And they know, like, most people wonder, like, they're gonna sit down and then they're gonna take it on their own. Like, you don't want to keep you out there, you don't want to touch. Well, you speak out. They don't see that. You should be able to talk. You don't want to.
Right.
Oh, Lord.
Give the
Okay.
person that's speaking the mic. Are we good?
Yeah, hold on, Etonia, 1 second.
no
Tolene
problem.
has 2 things, and then Etonia, you can go, okay?
First of all, good evening. I just want to, I have to do a shout out, okay? Because you all know my situation. You all know that I am a heart transplant recipient. And we have Dr. Daryl Nanny sitting right here, who received an award today at Einstein Montefiore Center for Advanced Cardiac Therapy. It was a collaboration award, and it is in recognition of outstanding collaboration, clinical expertise, dedication as an essential member of the heart transplant team. Your commitment to multidisciplinary care has profoundly impacted the lives of transplant patients and their families. Monty Hart, June 2026.
Okay. Now, Tolene is going to read for our lovely Joan Claude, who's not here today. She's going to talk about the awareness presentation for this month. And that is on.
Caribbean American Heritage Month, which has me right in there too. Okay, the history. Caribbean immigrants have been contributing to the well-being of American society since its founding. Alexander Hamilton, the first Secretary of Treasury, came from the Caribbean island of St. Kitts. Also, among other famous sons and daughters are the late Secretary of State Colin Powell, Cicely Tyson, W.E.B. Du Bois, James Weldon Johnson, Harry Belafonte, and Sidney Du Bois. The Institute of Caribbean Studies, ICS, effort began in, oh, here we go. 1 second. Began in 1999 with outreach to President Bill Clinton asking for the recognition of Caribbean American Heritage Month. This resulted in the first White House Caribbean American community briefing at the White House in 1999. Meanwhile, a now defunct ad hoc group of Caribbean Americans led by Doreen Thompson organized efforts to get June declared Caribbean Heritage Month in Washington, D.C. ICS joined forces with the ad hoc group in June of 1999, but by 2000, the group dispersed. In June 2000, ICS took on the mantle of leadership in Washington, D.C., changed the name to the National Caribbean American Heritage Month, and organized events in June under the banner. Efforts to engage the White House were fruitless. In 2001, ICS was joined by Trans-Africa Forum and the Caribbean Staff Association of the World Bank to organize events during June promoting recognition of June as National Caribbean American Heritage Month, and the momentum slowly began.
Thank you. Shout outs to all my Caribbean people.
Shout out to my father from Trinidad. Yeah.
Okay, shout out to the Jamaicans, Trinidadians, St. Kitts, Panamanians. Belizeans, there's a whole list. So just shout out to all the Caribbean people because we'll be here all day talking. Okay, next up, Etonia, you can continue, sorry.
It's no worries, because that was an excellent leeway back into voting. So voting, as far as the NAACP is concerned, yes, that stands for the National Association for the Advancement of People of Color. However, you do not have to be a person of color in order to be a part of the NAACP, because voting is a cornerstone of all communities. So all you have to do to be a member of the NAACP is just be pro social justice, pro your fellow man. And the easiest way that we can assist our fellow man in our communities is by getting out to vote, because literally our local elections are the main way that we actually see real changes happen in our community. By being a part of the democratic process of selecting the people that represent you, you are actually putting actual stake into your community. So I'm not asking everybody to do everything. If you feel you want to join the NAACP, that's a great move. If you feel like joining organizations like NON, that's a great move. If you feel like being on the community board, that's a great move, because we are a voting body and we help to make the decisions happen within our community. However you can get in where you fit in, that's how you do it. And sometimes the easiest way is just literally helping people out when they have a question for you. Because I'm pretty sure everybody there, because you're on the community board, you have become semi-famous in the last 3 months, and everybody is coming to you to ask you every other question in the world. So I'm going to give you the answer to the easiest question that they're going to ask you. Where is my early voting site and where is my election day site? So you're not going to give them a dissertation. You're just going to keep it short and sweet. If you see right here, you can go to the same place that I'm going to, which is findmypollsite.vote.nyc. That is the official website of the Board of Elections for the City of New York. So if you come across anybody in our community that works in our community but doesn't live or vote in our community, just simply ask them to go to their Board of Elections website. So for example, if you meet somebody that comes from Mount Vernon, you wouldn't ask them to go to the BOE website for the City of New York. You would just ask them to go to the Westchester version of the Board of Elections. But let's say a voter came to you and they said that they live at 4101 White Plains Road, which is the same place that some of us feel that we live at all the time because we're there all the time doing these meetings. All you would simply do is put in your address and click Find My Poll Site. And this is the best part of it. It literally gives you all this wonderful information. You can actually see a real version of your actual ballot. So let's say someone actually lived and voted in this area, and that was the address that they utilized to register to vote. These are the contests that are available to that voter to vote on, which would be state comptroller as well as the 15th congressional district. Now, here's the key thing you want to say to people. Do not call the Board of Elections to ask about information about candidates. That's not what their job is about. Same thing with the NAACP. That's not what their job is about. The NAACP is a nonpartisan organization. We accept you as you are. If you're registered to vote, that's great. If you're not registered to vote, that's also not so good, but we'll still accept you. Board of Elections is a bipartisan organization. It is a quasi-agency for a reason, because they are there to represent all voters, and the major parties that are represented in our area are Democrats and Republicans. So when you call the Board of Elections, it will either be a Democrat or a Republican that will be able to service you for your question. But the main question that the agency gets is, who's on my ballot and who should I vote for? We cannot tell you who to pick. So you will simply tell the person, please do your own background information on any of these candidates and ensure them with this knowledge. If you don't know any of the candidates or you don't like any of the candidates that's on your ballot, you are not obligated to pick any of them. You may write someone in if you would like to do so, or you can leave that entire contest blank and move on to the next contest, meaning that that first contest won't count, but for whoever you select for the second contest will. You also have the option of leaving your entire ballot blank. And that is considered a protest vote. It is essentially saying, had you given me better options, I would have made one. The difference between not voting and a blank ballot is this. A blank ballot is actually you casting a vote for no one and keeping you on the rolls and keeping you active as a voter. Not showing up is not voting. Two completely different things. So that's the information you'll leave with people as soon as they ask you, well, should I even bother to go vote? You tell them absolutely yes. You want to remain on the rolls, so that's the best way to remain on the rolls. Stay within the democratic process and do your own due diligence and research by going to different organizations' events that give you information about the candidates so you can make a definitive decision for yourselves. Now, the best part about this website is one, that it's free, and two, that it's active for the entirety of early voting. So if you live or work, excuse me, not if you live or work, if you are registered to this address, your early voting site is Our Lady of Grace. But notice that says early voting, and it gives you exactly where you need to go, whether you want to use the accessible entrance or the voter entrance, because sometimes they're different, meaning not all exits or entryways are ADA compliant. So if you're like myself and you're trying to avoid steps at all costs, I'm going to look for the accessible entrance. And they even do you a favor of giving you a map so you can see exactly where that is. It also gives you the hours for early voting. So there's voting hours for today, which ended a little bit early, and tomorrow, Juneteenth, which is the federal holiday, which is another thing you want to remind your neighbors. Just because it's a federal holiday doesn't mean that early voting stops. That is also a federal regulation, which is voting. So no voting stops until June 21st. Now, let's say you didn't get a chance to go any of these days or any of these times. That is okay. You can go on election day, but just make sure that your election day site sometimes is not the same as your early voting site. In this particular instance, for this voter, their EV site is the same as their general election day site. So they'll be going to the same place, but note the difference, the hours. If you would like to show up to vote on election day, you are more than welcome to, and I encourage you to do so, especially if you didn't get a chance to vote during early voting. Just make sure that you get there between 6 a.m. and 9 p.m. Eastern Standard Time. If you show up at 9:01, you are not entitled to vote. Anybody that's in line before 9 p.m. is entitled to vote. So the line could be going around the building at 10 p.m. But that means that all those people on that line were on that line before 9 p.m. Eastern Standard Time. So please give people this wonderful information. And if they have any questions, comments, or concerns, they can always reach out to the Board of Elections, or if they're experiencing any type of voter intimidation, they may also reach out to the NAACP New York State Conference to make that complaint. For all of my folks that are hard of hearing, you are entitled to a ASL interpreter. It's just that you have to get a request put in with the Board of Elections at least 48 hours in advance. So if you decide to go to vote tomorrow, it's too close for you to ask for an interpreter. But if you're deciding to vote on Saturday, you are well within that window to ask for an interpreter. Same thing for June 23rd. If you want to vote on election day, you can ask on that Sunday, put in a request, and the BOE will follow up you with interpreter services. So don't feel that you are being ostracized in any type of way. The sites are set up in a way that everybody can be able to vote independently. But if you need a little bit of help, do not be scared to ask, or just get some help from the team that's there on election day. Any questions? Is everybody good?
No, we're good, Etonia. Thank
All
you.
right. Happy voting and happy early Juneteenth.
Thank you. Thank you. Okay, go ahead, Daniel.
Can you hear me?
Say that
Yes.
again. Yes.
Okay.
You're gonna have to talk a little bit louder.
All right. So thank you, Tonya. I wanted to bring up World Refugee Day. Is that fine?
Daniel, you gotta introduce yourself, my friend.
Oh, okay.
A little
let me turn on
formal.
my camera.
Thank you.
Hi everyone, my name's Daniel. I'm currently on the community board, on the youth and education committee. I'm a college student. I'm also 19 years old. I'm also involved in the youth council for the NAACP.
We're currently actively working on like expanding the council and stuff like that. I'm pretty sure Troy is also a part of that too. So hopefully we get more people along the way and really expand. I wanted to recognize World Refugee Day because it's actually on Saturday, and on Saturday there's gonna be a Harlem event going on as well, which is surrounding like vocal advocacy and voting rights. But World Refugee Day is essentially an international day organized every year on June 20th by the United Nations. It's designed to celebrate and honor refugees from around the world. This day was established in 2001 in recognition of the 50th anniversary of the 1951 Convention to the Status of Refugees. I really wanted to highlight this day because it's in this country we have seen a big suppression around people who come from outside the United States and people who aren't really I guess quote unquote born in here, and none of us are truly born in here. We all know this is stolen land. So I just wanted to bring a light to the Refugee Day because a lot of people come from other countries to escape what's going on in there. I know my family personally comes from Honduras, and we had to, my mother had to escape like I guess the gang violence and the stuff that was going on in Honduras to come to the United States and come over here, migrate over here, and start a family over here. So I thought this was a really important day to recognize. Also, some famous people you may know, Albert Einstein. He actually fled Nazi Germany in 1933 due to his Jewish heritage, and he came to the United States. Also, Sigmund Freud, which happens to be the father of psychoanalysis, he escaped Nazi Germany as well for persecution. I also wanted to share my screen to share with you some opportunities that's going to be happening. I'm going to take.
Daniel, can you do me a favor? Instead of doing that, can you drop it in the chat for me?
Okay, no problem. Yeah,
Yeah,
so
I'm sorry. I'm trying to get everybody out of here by 9 o'clock today.
yeah, the time. Okay, so the first opportunity is called turnup.us. It's basically an internship program that surrounds like vocal advocacy and democracy, getting like the youth involved, like whether it be from voting. They're also nonpartisan, so it's not Democrat or Republican or whatever party it is. It's mainly about getting the youth like involved in like voting and just making sure they know what it is around voting and stuff like that. The other thing I wanted to highlight, I'll drop the links in the chat, but the other thing I wanted to highlight was the Borgen Project, which is an international organization that also has an internship for young people. Both of these internships are remote, they're fully remote. What you'll be doing is essentially advocating on their behalf to like email your local Congress member and talk with them about getting legislation about people who are struggling with poverty and stuff like that in different areas around the world. Again, I wanted to highlight the Youth Council for the double NACP because we're looking for young people ages 8 to 25. If anybody knows any young people, please reach out to either me or Tony or Troy because we want to expand this Youth Council. I believe it's currently inactive. So we want to get as much youth and people involved with it so we can have an active Youth Council because that would be an integral part of the community who can also become leaders later on. And also, we have the Juneteenth week of action, which is actually on the 20th this Saturday, which will be let me see if I can find the address really quick. I'll drop all this information in the chat. So if I don't briefly find it. So this will actually take place in Harlem from 10 a.m. to 1 p.m. and it's on Adam Clown Boulevard, Junior State Office Building, Plaza 161 West 125th Street. So if you're looking for something to do on Saturday and get and advocate for the freedom, protecting our voting rights, and all the power to the people, then I would suggest showing up and showing out for the community and stuff like that. So that will conclude my segment of all the stuff that I talked about. I hope you look into it. I will drop it in the chat. Thank you so much.
Thank you, Daniel. I appreciate that. I did not know about World Refugees Day, but now I will put that on my calendar. So moving forward, I will know it. Thank you very much for that information. And please don't forget to put all of that in the chat for me, okay? Next, we have Carol Singleton. You're with Children's Aid Society?
Yes.
Yes. We're going to have her talk for a little bit, okay?
Hi, I'm another one of your retired teachers here at the table. And I worked with Pauline at one point in my career teaching. And when I left teaching for a little while, I ran a community center in the Bronx. And then somehow I found the job that's called education specialist. And I've been working at Children's Aid about 6 years. I'm a supervisor in that department, and I usually talk a lot about our college program because that's the one that I supervise. And we have 53 children in college that are either still in foster care or were formerly in foster care. They're going to many different schools on full scholarships, including Columbia, NYU, Howard, CUNY, all the different CUNYs that we have in New York, U Buffalo, and so they're going to school all over. The two programs I'd like to make everybody aware of, because a lot of times people don't realize, even if a child is no longer in foster care, if they were in foster care at 13 and 1 day, and then they were no longer in foster care, they can participate in this scholarship program. So, and it's worth a lot of money. Okay, one of the programs is called FYCSI, FYCSI. And with that particular program, all of the schools in New York City, the CUNYs, and many of the state universities, once they apply for their TAP and their FAFSA and their ETV, the FYCSI fund will cover the rest of their tuition. So that is worth a lot of money. The other program is called College Choice. Now, the College Choice program, you do have to be in care when you start. But if you're out of care after that first time that you started, you can continue. That one gives you even more money. That's the one that can make up the difference in tuition with a place like Howard or a place like NYU. We have one student at NYU. We have one student that graduated from Howard with her bachelor's and then went to Columbia and got her master's. And so with that particular program, what happens is whatever is over what's covered by their financial aid, they can spend up to $30,000 more, whether it's the housing or the tuition gap or whatever. And they also get a monthly stipend of $1,800. So they get 2 payments of $900 a month to sustain them so that they don't have to have a part-time job and they can focus entirely on their studies. So these programs are very worthwhile. Then we also have a new program that ACS began supporting called Career Choice. So some students don't want to necessarily go to college. They might want to be a plumber, or they might want to learn construction, or they might want to do hair and makeup. Okay, so that's the new program that they started, and it's similar to College Choice. It does cover some overage in terms of tuition for the program, and the students do also get a stipend. The only caveat with that program is this. The College Choice program will cover also your room and board if you're living in a dorm, okay? The Career Choice program, they want you to either be in a foster home with, they know you have housing, or you already have moved into your own housing. So you've already, applied for housing and received it. They want the stable housing because that program doesn't cover the housing, okay? But they're very, very good programs. And like I was telling you before, we have quite a number of students. We're the second largest agency in the city, and we have the most students in college. This year we have 53 in college, and we have 17 high school graduates, This year, one of them is going to be the valedictorian of his high school class. And 13 of them know they're going straight on to college. They've already applied and been accepted. 3 are still deciding whether they want college or trade school. And we also had another program we were focused on a lot this year, which has to do with the amount of chronic absenteeism there is for our students. So we've been doing various things. I'm not going to go through everything that we did to try to correct that. And so we've had an improvement of about 10%, which is a big improvement, really, with all the different challenges. And 5 of our students that were originally chronic absent started going back to school, and 4 of them graduated, and 1 of them got their GED, and all of them are going to college. So I really wanted you guys, and if you guys ever have any questions about these programs, please reach out to me. Talene has all my contact information, just my work email, my home email, and my phone number. So I'll be glad to help anybody. So since Children's Aid is we're in the foster care part of Children's Aid, because Children's Aid has a lot of parts, right? So the children that are still in care are still monitored by my department, which is education, and also the case planning department. And so they're monitored through that. Once they age out, just my department follows them through. And we keep them. We have students that we've assisted way after they've been out of care. They're 25, 26 years old, and they just graduated. So once we have a student that we're helping, we don't stop helping them. And we make sure they graduate.
Hey, y'all. You gotta be on the mic. We can't hear you on this end.
Something happened.
I know quite a bit about the Children's Aid Society because I know a lot of parents that attend, children that attend my nursery schools or after-school program. They get some kind of assistance from Children's Aid Society. Now, these children are aged up until you say graduate from college, and you still follow up on them. When they get jobs, how do they get their jobs? When they
So, one of the things that we also assist with is we have one housing specialist that we have them go to so that what we try to do, initially we weren't doing this, and when we realized we got to make sure they have housing, right? If they're graduating. So we really started making sure that the students go visit the housing specialist at least 6 to 8 months before they're going to graduate, so that they can have housing by the time they're graduating. The only caveat to that is that if they're in a dorm, they can't have housing at the same time. So that's why we have to time it like that. Yeah, so that they have their housing, like they're graduating and they have housing.
You got a great job.
Thank you. I'm telling you something, like when you love what you do, it's not work, right? It's not work. It's not work. It's not work.
That's how it is.
Yeah, I hear you.
Thank you so much, Carol, for that. That's actually a really cool thing. I love, us having resources for people, It's real important to show different avenues to get to the place that we need to be. All right, we're moving right along. I think I'm doing really, really good on time. So I think we only have a few more things and then we should be at the end. I can say what I want to say? Okay. So unfortunately, I say PIC, partner in crime, is not here today. So, no good. Oh, hi. Abraham, you got to speak on the mic for me. You got to talk on the mic. Thank you.
I don't want to disturb anything, so I
No,
just
no,
try to
no.
be quick.
Go ahead. Brief. Give me a
Alright.
brief 5 minutes. You got it.
Well, I'm Abraham. Yes, I'm Abraham Wallace. I'm 24. I was with Children's Aid for a while, and Ms. Singleton helped me to fill out applications, work with school stuff, everything. And all the stuff she's saying about the programs like College Choice, it really is true. They cover tuition, they'll help you with fees, anything you need, filling out stuff. If you need a tutor, they can even help you with that. It's real, real good. I'm currently going to Hostos Community. Yes, liberal arts and with the concentration in psychology. Well, I'm in my sophomore, going into junior year. Thank you, thank you, thank you. Yeah, but it wouldn't have been possible without Children's Aid. They've helped me completely along the way, even with housing. They did recommend me to a housing person. That person was in this other organization called Next Generation Center. They're also really, really good as well. Oh, yeah, sure. I will. Thank you, thank you, thank you.
Okay, moving right along. So next is me and Alpha, but unfortunately Alpha's not here today, but I do want to briefly talk about the event that we just had on June 6th. The Community Connect was such a success. It was a really great event. I'm very thankful for everybody who came out and supported. I'm very thankful Miriam was one of the vendors that we had. I'm very thankful for all of the people that showed up, all the people that contributed, and all of the people that helped out behind the scenes, in front of the scenes, all of the good stuff. So I just want to throw that out there. And with that, I got a couple of announcements and then we are done. Bridgefield Civic League has a nutrition health smoothies and healthy drink, healthy eating each week at Freckles. They have it Mondays during the day. Camps are invited. This is every Monday from 6 to 7. They at Bridgefield Civic League, they are also having, I don't know what this first word says. Oh, Daley Smith, The Power Within STEM, presents Thursday STEM workshops at the Bridgefield Civic League for 6 weeks. It is from 5 p.m. to 6:30. I promise you, I am almost done. So, the next one we have at Bridgefield is that they're doing a podcast series starting in July every Thursday. They are also doing a 3D printing STEM learning that is starting on, this date must be wrong, but it's on Thursdays from 1 to 3. And then lastly, also starting in July, they are doing a youth chess program. That is starting Tuesdays in July. It is from 6 to 7:30. So they have a good couple of things for programming for the summer. Is there anything else, Tony? Okay. Sure. On the mic.
Our speaker, the Assemblyman Carl Hasty, allocated money to build 3 schools in our district. 189, which is called the Rosa Parks School on Steinwick. Willie P. Bowman campus, which is across from KFC on Boston Road and Volkswagen. And the Al Tuitt campus, which is located on 227th and Bronxwood, right across from McCall. Now, Baychester Academy, which is the Willie P. Bowman campus, is continued being called Baychester Academy, and it's not Baychester Academy. When we cut the ribbon for that school in 2005, it was called the Willie P. Bowman campus that housed Baychester Academy. Now, our superintendent of District 11, Christine Vaughn, was the first principal at that school when it opened in 2005. Now, she's no longer there. She's the superintendent of District 11, and her AP, Ms. Gardner, is now the principal. Here's the situation. A couple of years ago, or when this continued, the school 169 continue to be called Baychester Academy. March of 2026, we decided to have an event to the principal and the parents to let them know that this is the Willie P. Bowman campus. And we did this on Women History Month of this year. We had Shirley Farron, the district leader, Laura Ferrodan, and many parents and people that came out. We fed them, the principal was there, and we had 2 students from her school, 169, to let everybody know in the community this is the Willie P. Bowman campus. Here's the irony of it all. The name Willie P. Bowman is on the building. It's written on the building. I attended their graduation yesterday, and many things happened. I stood there and, well, let's go, had 59, 89 to almost 100 graduates. It only goes up to grade 5. Then after they graduate from 5th grade, they go on to junior high school. The salutatorian and valedictorian were equal. They were both good. However, our councilman, Raleigh, Kevin Riley's daughter was the valedictorian, and the salutatorian was a young lady that lived next door to my nursery school. Both were good. Okay, and I've had the opportunity to speak with both students through the course of the year. The speaker, the keynote speaker, was a Pratt sorority brother from Councilman Riley's group. What annoyed me and got me so emotional, the superintendent, who once was the principal, got up and spoke about how her mother, and the principal went along with it, Principal Gardner, how her mother encouraged her to call this school Baychester Academy. Well, I nearly went under the roof. I came there to present a certificate to the salutatorium because I decided in March to create a scholarship in Willie P. Bowman name through my organization. And the principal selected the young lady, never knew she was going to be the salutatorium, but I sent a note to the superintendent yesterday while the principal was enlightening us about the superintendent's mother. Her mother. Now, I'm standing there being a mentee of Willie P. Bowman. Like I said, nearly went under the roof. She acknowledged me, and she had the principal to call me up. Well, you know I wasn't going to leave until I speak, if you know me. And I insist to all the people, it was a packed tent in the schoolyard. And I let them know, this school house Baychester Academy. Even a blind person that could read the Braille could go outside and see the name on the building. And the people was at awe. Even the parents of the graduating class did not know that. And they had everything written with Baychester Academy. And I insist to the principal yesterday, the school is under Willie P. Bowman. The name is on the building. Carl Hasty, the assemblyman and the speaker allocate this. And I'm asking the Ed Committee and the board let's do something about this, because I wrote the councilman a letter this morning, very nice letter. I'm going to send a copy to Ms. Dixon and let her know what I wrote, because I said to the councilman yesterday, he said, I said, no, you can't talk to me right now. I'm too emotional, because you sat there and you had the opportunity to say something. When you got up to speak about the graduate and your daughter, you could have easily said, this is the Willie P. Bowman campus, and you didn't. I'm asking the Ed Department and the Board 12 to make sure that Willie P. Bowman name that is on the building be recognized. I deal with 44 schools in District 11, and every school that has a name, like for instance, Bronxdale, across from Maestro, is called the Van Ness School. PS 78 is called the Hutchinson School. 111 is called the Seton Falls School. And, I know them all. And they recognize them. So why can't we recognize Willie P. Bowman campus?
Dr. Goff,
at
may I
169?
quickly interject? How y'all doing? All right, so you are absolutely right. These schools are named for the people in our community for a reason. such as the Richard R. Green campus and the school that you mentioned earlier. So to be completely transparent, yes, we are willing to work with you, and we are continuing to work with the principals at those schools so that the students in our area understand the weight of the history of those people, that they're not just arbitrary names on a building, that these are people that literally have led, just blazed the trail for this community. They've done almost as much work in their individualized lives as the community board has done itself in its extension of the expansion of educational resources and the well-being of our children. So I want you to understand that no, none of this is going unheard. We are working in tandem with those principles to make sure our community reflects the actual greatness that lays within it.
Okay, so you just gotta make a motion at full board. And yeah, you just gotta make the motion at full board, which is next week, so. Yeah, and you should probably reach out to the chairperson so that they can put that on the agenda like now, because he's probably already making it. You should reach out to the chairperson to put that on the agenda. He's for next week. So he's probably in the process of making it already. So you should probably email it. Yeah, call him or email him now. Clinton. Yeah, Clinton. Okay. Ren, you look like you over there eating. From Senator Bailey's office, would you like to say a few words real quick? Yeah.
Just as he got his ticket.
I know, I feel so bad. He was like, and I felt so bad.
Oh, hi, my name is Ronell from State Senator Jamal T. Bailey's office. We have several events I'd like to update you guys on. So we have our job fair, that's June 30th at the Bay Plaza Mall Food Court. That's from 2 to 5 p.m. We suggest bringing a one-page print. Let me rephrase that. If you could bring several resumes to the job fair, just to ensure that each organization that you're interested in receives your resume. Also, we have our our annual community barbecue. That is July 18th. If you'd like to attend, I would RSVP as soon as possible, as those slots fill up very fast. It's from 1 to 4 p.m. in front of our office at 959 East 233rd Street between Edenwald and Gunther Avenue. And lastly, tomorrow we have our Juneteenth event along with Speaker Hasty and Councilmember Riley. If you could join us tomorrow, it will be right in front of this building. It will end at East 212th Street and White Plains Road. So if you can meet us here and then make our way down there. Thank you.
Everybody better be at the Juneteenth rally tomorrow. That's all I'm gonna say. Etonia, last question, and then we are wrapping up.
Apologies. I never lowered my hand.
Oh, okay. You sure?
Yes, ma'am.
All
Y'all are
right,
doing
Tony.
great. Everybody have a wonderful Juneteenth holiday.
Can we end now? Okay, it is now 8:56. Tolene is gonna say, go ahead, say your 2 words again.
I'm just gonna, I just got threatened. Got threatened, that's 2 words. I just want to tell you how much I appreciate you all. Our committee is off the chain. I don't want to, say that too much, but yes, public health and education, we definitely do our thing. We've done it all year. We always have quorum. We always have a turnout, show up and show out. And I want to send you blessings and love. Anytime you need me, call me. Sounds like I was getting ready to sing a song, right?
You had 2 minutes. That's your two. Sherry, you want to?
We'll speak to the other chair.
I just want to thank everybody for coming and making a good turnout for our last meeting, and looking forward for next season with the community board with our meetings and bringing more information to the community.
And with that, it is 8:58. This meeting is adjourned. Everybody have a good summer. Do not forget, next Thursday is full board meeting. Have a good night.